My name is Kitonga Kiminyo, and I'm an infectious disease doctor here in Palm Beach County. As an infectious disease doctor, I spend my time split between the office and the hospitals. As an infectious disease doctor, I may see you in the office if you have a possible infection involving any part of your body. Furthermore, if you need any kind of treatment for that same infection, I have an IV or intravenous antibiotic infusion center in my office to treat those infections to keep you out of the hospital. Now, for many people who don't have access to such services, when they develop an infection, they can end up in the hospital. And so for many infectious disease doctors like myself, we spend most of our time actually in various hospitals here in Palm Beach County. As an infectious disease doctor, we see patients with all kinds of problems, including head, neck, lungs, heart, stomach, legs, feet, because it is an infectious disease specialty that encompasses all types of your body, meaning that we get to talk to physicians who are involved with everything from your brain down to your toes. Infectious disease is very exciting because of that very reason. We get to interact with many healthcare workers, we get to be part of the treatment plan, and we continue to take care of you even after you leave the hospital. And I enjoy doing this and will plan to do this for a very long time. So I'm very excited to be an infectious disease doctor because I'm originally from Kenya, which is in East Africa. I was born and raised in Kenya, where, as many of you know, is part of the East African coast. And because of where it is, there are some health issues that they face that we don't necessarily see here in the United States of America. And unfortunately, infectious diseases affects a good part of the healthcare system in places like Kenya and Africa. So growing up in Kenya, it was not unusual for me to hear about infections like malaria or schistosomiasis. And so these were infections that were related to different types of parasites and insects, and this intrigued me. I found this to be not only interesting, but the truth is most people, if they got treated correctly, were able to be cured of their different infections. So a big part of my excitement about being an infectious disease doctor had to come from the fact that people normally got better from their infection if they were treated correctly in the right amount of time. So when I left Kenya and went to the University of Iowa for my undergraduate studies, I kept this in the back of my mind. I decided to study biology as my college major, and I minored in African American studies. It was during this time in college that I wanted to dig deeper into health, and I took part in college work-study programs, doing medical research that did not necessarily have any direct relation to infectious disease, but it gave me an experience of what it's like to be in a lab, or what it's like to have a mentor, or what it's like to write a research paper. And all these things together further strengthened my thoughts about going into medicine. So once I graduated from the University of Iowa, I applied and got into the Howard University College of Medicine in Washington, D.C. Now, at Howard, there was a plethora and a wide diversity of not only students, but teachers. And we had a great infectious disease team there. And after I got my medical degree at Howard University, I stayed in the Washington, D.C. area and went to the Washington Hospital Center for my internal medicine residency and for my infectious disease fellowship. A big part of that was because, among other places in the world, Washington, D.C. is a center of people from all over the world, and so we saw many different infections, including infections I had seen back in Kenya, like malaria, from returning travelers. So this continued to pique my interest, and again, the fact that you were able to interact with different types of doctors and nurses and pharmacists as a part of this infectious disease team made me, or rather convinced me, that this is what I wanted to do. And so I ended up finishing my fellowship in infectious disease, which is a 2-year fellowship at the Washington Hospital Center in D.C., and I subsequently looked for a job. And at that time, Florida had a lot of different opportunities, and the weather was not unlike that which I'm used to in Kenya. And so I came down here to Palm Beach County, where I joined a large infectious disease group and have practiced here for 18 going on 19 years. So for me, a typical day includes mostly attending the hospitals. There are many infectious disease doctors in Palm Beach County who do not go to the hospitals and are in the office, and that's fine. But for me, I find it more exciting to be in the hospitals, seeing patients, helping tackle their medical problems, finding a solution, and helping them to get better. So, usually what I do is I'll get up around 6 o'clock with my family. I will usually get to the hospital between 7 and 8 a.m. in the morning. I'll usually sit down at a computer. I'll look at my list. I'll print my list. A typical day for us may include anywhere between 20 to 30, maybe 40 patients if it's really busy, but usually it's between 20 to 30 patients a day. And what I'll do is I'll write down any events that would have happened since the last time I saw the patient. And there are also going to be new consults, which are patients that have just come into the hospital who are admitted by the medical team, and they need an infectious disease doctor to help solve their health problem. So once I have my list ready, I make my medical rounds, and usually in the course of the day, I'll be done, before 4, maybe 5 o'clock if it's really busy. Now, the good thing about being an infectious disease doctor is, you are able to interact with lots of different people. You're able to look at their x-rays. You're able to talk to the microbiology department and talk about the cultures. We also have a lot of opportunities before COVID to have people rounding with us, medical students, nurses, people who want to see what it's like to be an infectious disease doctor, or maybe to see what it's like to be in the infectious disease field, if not necessarily a doctor. So during the course of the day, we see the patients, we discuss the issues with all the different healthcare workers, and usually we're home by 5 o'clock. Now, usually if I'm seeing anywhere between 20 to 30 patients, I will probably generate in a year anywhere between $100,000 to $200,000. Now, as an infectious disease doctor, you have other avenues open to you. For example, I am also the chairman of infection control at one of the hospitals. Now, while that is not necessarily a paying position, it is a position of power that allows you to work with the hospital to help improve the health and the treatment of patients in the hospitals. And so you become involved not only with infection control, but you can get involved with sitting down in some of the boardrooms discussing these issues with the heads of hospitals, and that can be quite exciting. So I would say that I am very happy with my career in infectious disease right now, and that's because not only are my patients typically doing well and get home on treatment for their infections, but also because you have a intellectual challenge every time you're in the hospital every day. And having that intellectual challenge and having an opportunity to talk to different healthcare workers has made it that much more enjoyable. Now, specific to infectious disease is the fact that you don't have to do procedures. And so by not having to do procedures, you're not necessarily on call in the sense that a hospital will need to call you up in the middle of the night to come in and do a procedure. Typically, most infectious disease doctors are consultants. And so that makes for a much easier lifestyle. It makes it better if you have a family and you want to spend time with your children, your partner, your spouse. And I've found that that has been rewarding in that sense, because I know that usually by 4 or 5 o'clock, I'll usually be done with my workload. And so I would say that overall, and again, this is specific to me, but also I would say in general to most infectious disease doctors, it is a field where you get to use your brain. You don't necessarily have to do any procedures. You don't have to get called in late at night. Certainly, depending on how many hospitals you go to, you may have to work a certain number of weekends, on as part of your call schedule. But that's typical. But it isn't anything that is overly difficult to achieve. And I found that I've been able to spend time with my family. So I would say going forward, for those of you that are interested not only in medicine, but possibly in infectious disease, this is a very exciting time to do what I do. Of course, COVID-19 has changed the world, and while we continue to take care of people with COVID, there are still many infections that we are dealing with on a regular basis. HIV, hepatitis. There are people who come in every day with diabetic foot infections. There are patients with urinary tract infections. There are patients with back infections. So there's a whole gamut of infections that keep us busy to this very day, and will continue to keep us busy going forward. And so, based on the fact that you continue to be challenged by these medical cases, and the fact that the work schedule itself is manageable with family, I would ask that many of you consider a career in infectious disease. And I want to encourage as many of you to look at a field in medicine, and remember, it's not as difficult as you may imagine. Certainly, if I can do it, you can too. We know that there is college, and that can be challenging. But much like college, in medical school, there are opportunities for you to get scholarships, to get grants, and of course there are loans, which is what I did. But you know what? My loans are paid off, and certainly yours could be too. Because while you are in school and while you are paying for this special education, there is nothing like medicine, which gives you an opportunity after you finish your residency and your fellowship, if you want to do that. There is nothing like medicine that gives you not only the prestige of being a physician, but it gives you a really good opportunity of making enough money and supporting your family and paying back loans if you have them. So I would continue to encourage you to remember that there's a lot of opportunities available in medicine. It is something that you are capable of achieving, and the quality of life and the quality of your work will be amazing.